We are a university hospital located in Brussels, Belgium. We have 7 CT systems installed that consist out of a mix of vendors. From GE Healthcare, we have 3 Revolution Apex scanners. In total, we have around 200,000 patient contacts a year. 42,000 of them are CT examinations. CT spine examinations and their reconstructions can present some challenges for us radiologists and radiographers. One of the main pain points radiologists and radiographers face when manually making CT spine reconstructions is the time and effort required to accurately identify and reconstruct the relevant images. This can be a time-consuming and tedious process, which can be prone to errors, especially when dealing with complex cases where the anatomy of the spine is distorted or abnormal. For example, in patients with scoliosis or other spinal deformities. This can result in an incomplete or inaccurate reconstructions, potentially leading to misdiagnosis or ineffective treatment plans.
The main challenges we get confronted with during CT spine examinations are the combination of patient throughput and workflow. To finish a spine exam completely, reconstructions need to be made, but simultaneously we need to continue scanning the next patient. Because of this multitasking, it is easier to make mistakes.
I think from start to finish, a CT spine examination takes about 15 minutes while making the reconstructions manually. I think the problem with making the reconstructions manually is that it takes a lot of time, it takes a lot of clicks also, and every colleague has its own way of making the reconstructions, which means there's no standardizations of the reconstructions.
We have been using spine auto views for about 9 months now. Once the patient has been scanned, it starts automatically and will generate the required spine reconstructions in the background.
You just have to click done scanning and it starts and it finishes. Before using spine auto views, scanning a CT spine would take about 15 minutes, I would say, from start to finish. And now I can say with a patient that has much mobility, we can finish a scan in 5 minutes. My first evening shift, I had to scan about 8 to 9 patients in a row. And thankfully, I had spine auto views to help me, because without it, I would have had to work overtime for sure, because I finished just on time.
For me, spine auto views is just fantastic. Without any effort, you get the necessary reconstructions in your PACS. And in combination with my PACS hanging protocol, I immediately get the right reconstruction in the right place. The artificial intelligence labels the vertebrae and the intervertebral discs, and so I no longer need to count them myself, so I can concentrate to the pathology and the diagnosis. Now, with spine auto views, we can have up to 6 different reconstructions: axial, oblique and standard, sagittal curved and standard, and coronal curved and standard. Curved reformats are very useful in trauma cases, as they give a clear overview of the pedicles and the lamina in the same plane.
The biggest advantages spine auto views brings us are speed, efficiency, consistency, which aids to reduce stress and provides more time for patient care.
In one line, I would say that spine auto views facilitates our workload. Spine auto views is an easy-to-use AI tool. It helps reduces stress.
The main benefits spine auto views brings us are: 1, fast and reliable workflow; 2, less reconstructions on the PACS; and 3, clearer for clinicians thanks to anatomic labeling.